I got awfully sick. They said I had a UTI. I was dehydrated, and my kidneys were failing, and everything was going bad. They had me in a wheelchair, and they told me to get up to weigh myself, and I couldn't get out of the chair. That my heart rate was so low that I couldn't move hardly. Went to the med center and talked to Dr. Moulton. They did a heart catheter and found out that I needed, the aortic valve was not working right, and he suggested open heart surgery. So he told me about this other plan, and I was very hesitant. I didn't really want it till I got so bad that they said either have it or I wouldn't be living long.
It's a very new procedure, and it's changing the way that we take care of patients with aortic valve disease. By definition, right now, the procedure is only approved for patients who are very high risk for conventional open heart surgery and aortic valve replacement. I would say the majority of the patients are older patients. I mean, patients who are in their mid to late 80s or even into their 90s are probably the most common patients, because the procedure is probably best suited for people who are a bit too frail or for whom recovery from a standard open heart operation would be difficult. A procedure such as transcatheter aortic valve, which offers the potential of putting a valve in either with essentially no incision or a small incision in the groin, or sometimes with a very small incision in the chest, allows patients to recover certainly much more quickly than conventional open heart surgery. The procedure can be done one of two ways. If a person has arteries that come up from the leg, the femoral arteries, that are suitable sized for this procedure, then we would typically do that. If they don't, or if there's a lot of disease in those vessels, then we would approach this through some type of small incision in the chest. The procedure is done by the valve goes through a sheath, and the valve is crimped onto a catheter which is passed through the sheath, and then using X-ray and echo guidance right there in the operating room, we're able to position that sheath exactly where we want it with the valve. And then by inflating a balloon that's on a stent, the valve opens up, and inside of this stent is a working heart valve, so the valve opens and closes like a normal valve. It's very nice. Patients recover well. They don't have pain in their chest. They typically would go to an intensive care, but typically could be in and out of the hospital within 2 or 3, sometimes 4 days. There really is nothing else like this, and I think that the ability to do something that we could previously only do with open heart surgery and only do inside of the heart by opening the heart up on heart bypass machine is what really makes this a unique procedure.
I came out of that real good. I love it, and I would highly recommend it to everybody, and don't be afraid of it like I was. I can walk, and I'm not short of breath, and it's wonderful. Had no problems whatsoever. I can go places, and I use a cane, but that's because of a leg problem, not my heart problem, and I'm not short of breath at all, and I feel great. The care from doctors and the nurses was just excellent. I couldn't say enough about them. They were all very, very good.